What are the things that I did differently during my second child's jaundice? Hello everyone, welcome back to my channel. So today we'll be talking about how I cleared my baby's jaundice / all you need to know about jaundice and your baby. I've been thinking of doing this video for a very long time because when I had my first child, I didn't understand exactly what they were talking about, jaundice. And then when I told my mom about it, she now called a native name. So it was so complicated. I was so confused. So I know that a lot of new moms, some people even have 3 children, they still find it difficult to understand what exactly this thing is about and what they can do differently to help themselves and their children. So first of all, what is jaundice? Jaundice comes from the French word jaune, means yellow, and jaundice is caused when the blood contains excess of a molecule called bilirubin. And bilirubin is a yellowish waste compound that is produced when all the red blood cells are broken down. It's what makes our poop yellow. Is it brown? I think we poop brown also. Yes, and then normally bilirubin is filtered from the red bloodstream by the liver and then excreted through the intestine. But a newborn baby's liver is still very immature, it's still developing, and they can't remove or filter the excess bilirubin as quickly, which makes their skin yellowish because they are doing it slowly. They are still young, their body is trying to understand how to filter it. So because it's taking so much time, it now affects their skin, it now makes it yellowish. That's why the symptoms start from seeing the child having yellow eyes, yellow skin, yellow chest and all that. And the mild buildup is actually normal. It's common in newborn babies, and it is called normal jaundice, which can clear on its own for a few days or when the baby is being breastfed. And then we'll have type of jaundice in newborn babies. So the first type of jaundice, we'll have the jaundice of prematurity. This is when they give birth to premature babies that are less than 38 weeks. These babies' livers and lungs tend to be very immature, so they don't pass poo frequently, that they don't have frequent bowel movement. Most of them don't even know how to latch. So because they are not excreting it out of their system, it makes them have severe jaundice. And then we'll have breastfeeding jaundice. Babies develop breastfeeding jaundice when they are not getting enough breast milk from their mothers. They don't have enough bowel movement, so they don't excrete enough bilirubin. This happened to me when I had my first child. My breast milk came in fully at when he was 3 days. That was 3 days postpartum. So he had jaundice that the doctors were saying they'll put him under the light, but my mom said no, we'll take him home and then do it our way. So by the time he got to the 3rd day, it became so severe because there was not enough breast milk, so he wasn't pooing, so there was nothing to make him have enough bowel movement that will clear up his system and remove the jaundice. So breastfeeding jaundice is less common and is caused by substances in the mother's breast milk that interferes with the baby's liver and in the producing of the bilirubin that makes it so high. And then we'll have blood group or rhesus incompatibility jaundice. This is when the mother's blood group is different from the baby's blood group. Let's say, for example, the mom has O negative while the baby has B positive. So this is a major concern. That's why a lot of women who have those kind of negative blood group, when they're pregnant, they tend to look into their case. They monitor them closely. Some of them take some form of injections during the pregnancy in order not to miscarry their children. So the mothers make antibodies which travels through the placenta and attack the baby's red blood cells, resulting in an excess buildup of the bilirubin in the baby's bloodstream. That's for blood group or rhesus incompatibility. That's for the mom and the baby. And then we'll have bruising during birth. This is when the mother had complications during childbirth and then the baby had minor injuries to severe injuries. The red blood cells break down faster resulting in higher levels of bilirubin in the baby's system. So severe jaundice can cause the baby to have brain damage. That's why in the hospitals, when the doctors discover that baby had little traces of jaundice, they want to treat it immediately, because by the time the baby gets to 3 days, it might peak and you don't know the level at which the jaundice will increase to, and they are trying to avoid the situation where the baby has to have a brain damage and then they are going into a serious treatment. The baby is still very fragile, so most of them might not make it if they reach that level. So that's why once you give birth and they see traces of jaundice, the doctors are advising that they need to treat it. And then the jaundice peak at 3 to 5 days. Just like I told you that by the time my son was 3 days old, the jaundice became severe, and it happens like that. By the time the baby gets to 3 days to 5 days, that's when the jaundice becomes so high. So that's the right time to even know that this jaundice is in this baby's body. Premature babies are most likely to have severe jaundice because of the underdevelopment of their liver. When babies have severe jaundice, they are taken to the hospital, because some people, they give birth and then they come home that day. So when you notice that your baby is having yellowish skin and all that, they take the babies to the hospital. So their treatment range from putting the baby under the light, that's phototherapy, to blood transfusion for a more healthy blood cells. Children who have blood incompatibility jaundice, they give them a form of protein injection to break down the mother's antibodies that are attacking the baby's liver. And then we have symptoms of jaundice. What are the symptoms you look out for when you have a baby? So for the ones that are mild to moderate, you have breastfed babies, they have greenish yellowish stool. That's the kind of stool my baby was having. When we came home, her poo would be green and then we'll end with a yellow kind of color. And then for babies who are taking formula, they have the kind of green mustard color, and then their urine is so dark. And then for severe jaundice, they have symptoms like poor feeding. They are not able to feed. They tend to sleep easily on the breast, and then they are irritated so easily. They are always drowsy. They have yellow abdomen or limbs. They are losing weight, and then their temperature is always high. What are the things that I did differently during my second child's jaundice, that I treated her jaundice fast? Because with my son, I didn't understand what it meant, but with my daughter, we didn't notice in the hospital, but by the time she was 3 days, it was so much. As a matter of fact, it was his father that even noticed that this baby's eyes are so yellow and all that, and I'm like, okay. And then my mother-in-law was around, and then she said, yes, this is jaundice. And what we did was, I was breastfeeding her frequently, very often. Even when she was not hungry, I'll breastfeed her so that she can poo fast, and then she was pooing very well, because with my daughter, my breast milk started coming in when I was 5 months gone. When I was 5 months pregnant, I started having the liquid colostrum. So by the time I gave birth to her, there was enough milk for her, so she wasn't lacking milk. So she was eating very well, and then she was excreting fast. And then I gave her vitamin B complex twice a day for 7 days, 2.5 ml. So I will give her, vitamin B complex helps in clearing the eyes. That's the yellow coloration on the baby's body, and the vitamin B complex clears it, and then it heals infection in case the baby has infection. And that's for even babies that are bigger than infants from 0 to 12 months. Vitamin B complex is very good for them. His infection, his cough, and all those minor things that might attack them. So I was giving vitamin B complex. I gave it for 7 days, 2.5 ml morning and evening. And then I was giving her glucose 3 times a day. I would just make glucose very little, just half a teaspoon, dissolve in good water, and then give her 3 times a day. And we were putting her under the sun for early morning sun, that's 7 to 9 a.m. and then 4 to 6 p.m. Before 2 weeks, everything cleared up. If you see her eyes became so white. Some people, when they go to the hospital and they deliver their baby, and the doctor said you should give your baby, some people even think it's a kind of, they were talking about religion. In my religion, we don't do like this. If you want to take your baby home and put the baby under the sun and do any of the things I did. It's good to give it a trial, but refusing treatment outrightly is not a wise decision. So it is better to treat your baby's jaundice when it is discovered than allowing it to reach to a level where they are trying to do blood transfusion, they're talking about brain damage and all that. So I figured that the video will be helpful to someone, because if I had known what I know now when I had my son, and I wouldn't have gone through the emotional stress I went through. So thank you all. If you're new here, my name is Blessing Sule, aka the Fertile Mom, and thank you all to my returning subscribers. We are growing. I can see that we've reached 700 subscribers. In a few years time, let me say 2 years, we'll be talking about 70,000, and I'll still celebrate you guys that are here with me from the scratch. I'm a health coach, fertility coach, and fertility nutritionist. I help couples who are trying to conceive naturally through lifestyle changes and adjustments, multivitamins, and natural therapies, heal them and then increase their chances of conception to at least 80%. And then I teach women who want to know about their ovulation, who want to select the sex of their children in case you want a boy or a girl, and those who want to know exactly when they're ovulating so that they can meet their partner at the right time, and then those who want to avoid pregnancy naturally. And I do all that on my Instagram and WhatsApp. My Instagram is @FertileMoms. You can send me a DM or my WhatsApp. So go to my Instagram bio and then you click on the WhatsApp link there, and then you are in my WhatsApp, and then we'll talk about all your fertility or gynecology issues. And then here on this channel, every Wednesday we talk about health tips, fertility tips, and business tips, and everything in between. And then every Sunday I share with you my motherhood experiences, just like this video. We talk about everything baby development and all that. So please, if you like this kind of content, you can stay around, and don't forget to subscribe, share our videos with your friends, your Facebook group, so that they can come and see what is happening here. And don't forget to comment. Let's have your own thoughts. If you have a different view, or you have another thing that you did concerning jaundice that can help us on this group and community, please feel free to share and turn on post notifications so that anytime I post a video like this, it will notify you and you come watch. So thank you. I'll see you again next Sunday.